Welcome to the To Your Health podcast, your go-to source for everything health, fitness, and wellness related, as well as the latest in medical insights. I'm your host, Rhonda Alfred. Joining us today on this episode is Dr. Vinod Nair, an interventional cardiologist with CIS, Cardiovascular Institute of the South, and Terrebonne General Health System. Welcome to the show, Dr. Nair.
Thank you very much for having me here.
All right, let's get started. Can you tell us a little bit more about yourself and your role at both CIS and Terrebonne General?
Sure. My name is Vinod Nair, and I'm an interventional cardiologist, and I've been with CIS for the last 20 years. My area of focus and special interest is complex coronary interventions and chronic total occlusions.
Well, we have just won a huge award,
Correct.
the only one in the state of Louisiana, the Coronary Interventional Excellence Award. So can you tell us a little bit more about that?
Coronary Intervention Excellence Award is an award which is kind of awarded every year by Healthgrades, which is a large resource for hospitals and physicians for quality metrics. This particular award pertains to coronary artery interventions, angioplasty, stenting, high-risk PCI, where quality, safety, and clinical success rate is taken into account. And we are kind of ranked as top 10% in the country, and we are the only hospital in the state of Louisiana to get this award in 2024.
Why is this so special for both of our organizations?
It's very important because this is a yardstick that the patients can measure and know which hospital, which specialist to go. It also kind of shows the level of innovation, clinical skills, and the safety that a program reflects towards a patient.
Mm-hmm. And you say quality is a huge thing that's measured. Do you know some of the indicators that they look for?
Sure. There are two sets of indicators. One is while we do the intervention, the actual act of doing angioplasty and stent, the success rate, complication rate, radiation, as well as the quality metrics, how the patients are taken care of while they're in the hospital and then discharged. Are the patient provided with the right medications, right dose when they are discharged, right investigation performed before they are discharged home, and the follow-up care.
Right. So a lot of different factors are taken into consideration.
That's correct.
So why is this award so special and what does it mean for the people of our community?
This is a level of endorsement for the patients that they don't have to leave this town to go and get excellent heart care, world-class heart care. That level of care is available here at Terrebonne General, and between CIS and TGMC, it's provided. And also it gives a level of assurance to the patients that complication rate and safety has been looked into and sort of certified.
And that's important when you're looking to get a procedure such as this. So can you tell us, when would somebody need a coronary intervention?
So coronary interventions are usually done when a patient is acutely ill, somebody having severe chest discomfort, having a heart attack, or a condition called acute coronary syndrome, in which you have a plaque rupture resulting in less oxygen and blood flow to the heart. In a selected subset of patients who have been having worsening chest discomfort as an outpatient, if they fail medical therapy, then they would need coronary intervention.
And what exactly do you do when you perform an intervention?
Usually nowadays at Terrebonne General, probably 90-95% of the time we go through the wrist to do the coronary intervention. It used to be we used to go through the groin. It has been discarded because of better safety provided by the wrist access. And then we'll thread in a small wire through the blockage and open up the blockage with a balloon, followed by stenting, which involves placing a mesh around the blockage so that the blockage does not further aggregate and make more damage.
And you can get there by going through the wrist.
That's correct.
So it's pretty minimally invasive, it sounds like.
That's true, yeah. Usually the patients go home the same day. Around 80% of our patients go home the same day following the coronary intervention. A small percentage, around 20%, stay overnight based on amount of dye used and amount of time we spent.
So what is coronary artery disease? How does somebody know that they have this?
Coronary artery disease is a systemic process in which it doesn't just affect the heart, it affects the entire body. It can present itself with shortness of breath, chest discomfort when you do activity, dizziness, even passing out.
So you're aware when you know when this is happening to
That's
you.
correct.
It comes on all of a sudden.
It can usually happen over a period of time. Unfortunately, most of the time, patients do not recognize it's coronary artery disease. They may chalk it up to just having shortness of breath because I'm a smoker, or I'm probably tired or getting old. But in reality, it may be coronary artery disease and less flow to the heart muscle causing these symptoms.
And what are some of the risk factors for coronary artery
Yeah,
disease?
there are multiple what we call modifiable risk factors, and there are some non-modifiable risk factors. Non-modifiable risk factors is genetic, what you inherit from our parents that we cannot modify. Then there are modifiable risk factors, which include type 2 diabetes mellitus, high blood pressure, high cholesterol, obesity, as well as cigarette smoking.
So all the things that we know that we need to stop or modify or take care of can lead to this.
That's correct.
How do you diagnose this disease?
There is a variety of diagnostic studies available nowadays, starting from an ECG, a treadmill stress test, or a nuclear perfusion scan, as well as a test called a coronary artery calcium score. All of these are non-invasive, and I would say 8 out of 10 patients who go through these diagnostic studies can be treated medically, not going to have an angiogram. Only 2 out of 10 will end up needing further investigation in terms of an angiogram.
And is there a way to prevent this disease?
Yes. If you have diabetes, getting your diabetes under good control, exercise and living a fairly active lifestyle, weight reduction, controlling high blood pressure, as well as cholesterol, managing cholesterol. Yeah.
So if you do have it, how is it treated?
Most of these patients are treated medically, and there are many medications nowadays available, most of them being generic to treat this condition. Only patients who are unable to proceed with medical therapy alone in terms of having refractory, recurrent breakthrough chest discomfort or other complications would need to go for an angiogram.
Does it affect men more than women or women more than men? Or
it affects both genders equally. However, there is a small difference in when they develop heart disease, coronary artery disease. Patients who are premenopausal, usually in female side, they don't have that much coronary artery disease. The female hormones are protective towards coronary artery disease. But once the menopause is achieved, then their risk catches up to males.
Is there a certain age group that's more prevalent for this disease?
Yes. So usually we see this starting from the 40 plus. It's rare to have coronary artery disease in the 30s or 20s. It's not, we have seen it happen, but it's rare. But usually 40 plus would be when you can expect this.
Mm-hmm.
Yeah.
So one of those great things that starts happening in the golden years, right?
That's correct.
Well, what would you say to a patient, if they were diagnosed with this disease? How would you try to help them?
I think it's easily treatable, especially if you are diagnosed early. You can probably avoid majority of the invasive procedures. If you aggressively manage with medical therapy, you probably will never need to come back to the hospital for interventional procedures. This can easily be treated with commonly available generic medications. So diagnosing is the most important thing. Getting to the doctor is the most important thing. Yeah.
So when should somebody come and see the doctor about this?
If you don't have multiple cardiac risk factors that I earlier alluded to, probably around 50 to 55 years of age would be a good time to come. If you have family history of premature coronary artery disease or history of diabetes, hypertension, or dyslipidemia, you probably should start earlier. Blood testing should start in patients with multiple risk factors or family history should start at age 20 and repeated every 5 or 10 years. And diagnostic studies or stress tests, if they have symptoms, that will be a good measure.
Yeah. So you really should start getting a baseline on your health, establishing a relationship with a physician at an early age.
That's correct, especially if you have risk factors or strong family history.
Okay, so tell me how you felt about receiving this recognition.
Oh, we feel very good about this. And the cath lab, the hospital, and we all at CIS, we feel this is a great honor because we do approximately 1,000 angioplasties, around 1,000 coronary interventions a year. And to be attested to say that we perform in the top 10% across the United States means a lot.
Right.
It just shows dedication, consistent delivery of care, and adhering to safety procedures to attain this.
Right.
And we want to get it next year also.
Right. I mean, you know you're good, but it's nice to have someone else saying, hey, you meet all these criteria, you've gone above and beyond, and you've achieved this award. So it is a huge accomplishment. It says a lot. You know, we've had a long-standing relationship, Terrebonne General and CIS, over 40 years. Tell us how you feel about that relationship and what you've been able to achieve in the cardiology program.
I think this is a great relationship, and I've worked in many other states, including New York and Texas. The type of relationship that CIS and Terrebonne General has is symbiotic, it's very proactive, and is able to, for us to do not just getting this award, but also innovative things like first in state, first in the country, ability to lead rather than follow. We're able to do that because of this relationship.
Yes.
And ultimately, the patient benefits in terms of quality of care and safety.
Right. And I mean, so many people around here are affected by heart disease. You know, our lifestyle plays a big part of that. What would you say about, you know, treating the people in this area?
I think cessation of smoking and use of tobacco products and nicotine is of great importance. That's probably something that differentiates this part of the country. And number two would be early diagnosis and leading a very active lifestyle. Would be the three suggestions that I have.
So that's the main thing you'd like people to know.
That's
they
right.
can do to help prevent. Say that one more time. There's three things that people can do to help prevent.
Cessation of cigarette smoking, use of nicotine products, being active, and especially if you have risk factors like high blood pressure or diabetes, coming and seeing a physician early enough and getting tested would be the three things.
Okay. Well, thank you so much for your time today and all you're doing for the cardiology program here. And we appreciate you being on staff.
You're very welcome.
For more information about the Healthgrades Coronary Interventional Excellence Award, visit tghealthsystem.com. Thanks for joining us today, and don't forget to like, share, and subscribe to our podcast where you get your podcast. Thanks for joining us.